Hi everyone, I'm Paul. I'm also from the ANU. I work with Emma and a few other great people there on the same childhood wellbeing project. And yeah, as Sharon said, today I'm talking about early life protective factors for adolescent self-harm and suicidality. Just by way of a bit of background, so obviously self-harm and suicidality is a really serious health concern. It can emerge in adolescence or even earlier in childhood. In Australia, yes, so rates of suicidal thoughts and plans actually doubled for young people between 2007 and 2022. And the research around self-harm and suicidality has tended so far to focus more on risk factors, less so on protective factors, which we're trying to redress. So the aim of this study, which is just completed, it's just been published, is to assess how domains of wellbeing in the middle childhood years, so for 6 to 12-year-olds, can help predict or protect against experiences of suicidality and self-harm in those adolescent years. So before I get to our study, I'll give just a little bit of background. And for anyone who was at the previous session, I think there was a really good introduction to the NEST framework, which is ARACE's childhood wellbeing framework. Just a couple of points to, I guess, re-emphasise from that. It's a participatory framework, so children themselves were involved in defining what's important to their wellbeing. And they came up with these five dimensions, or six dimensions, but we're focusing on 5 in this study. So we're not looking at identity and culture for a couple of reasons. One, it was introduced a bit later on to the NEST framework, and it looked like it actually correlated with some of the other 5 domains as well. So our focus is on valued, loved and safe, material basics, healthy, learning and participating. And each of those is kind of comprised of a few what I'll call subdomains, so just factors that kind of relate to those broader level domains. We use LSAC data, so again I'm probably going to assume that most people have come across LSAC, but it's a large longitudinal survey of Australian children. It's been conducted every 2 years since 2004. We used the birth cohort, and for our outcome variables we were looking at 14 to 15-year-olds, and then the predictor variables we were looking at multiple waves throughout childhood from ages 6 to 12. And so in this study we actually built on the work of a previous study. So Kate Solis and Ben Edwards did some work a couple of years ago. Kate is here, and I'm sure some of you know her. So what they did, they actually took the NEST domains and the subdomains, and they found measures in LSAC that sort of best capture each of those domains at multiple points in childhood. So for each of the 19 subdomains, they came up with sort of the best available measure on LSAC. So just a quick example of what they did and what that looks like. So for the domain of valued, loved and safe, which is comprised of these 4 subdomains. So in the first wave, they measured relationship with parents using a question around having fun with your family. And that changed a little as children got older and different measures became available on the data set. So that's important to remember. So when we're talking about, say, a wellbeing need being met, the actual underlying question did change across time, and that's because children's wellbeing changes across time. It's also perhaps because of the availability of the data on LSAC. And so a wellbeing need was met on a domain if they had their needs met on all of the subdomains. And in our study, we looked at both the domains and the individual subdomains. We basically just ran a lot of models predicting self-harm and suicide outcomes in adolescents, and just looking at how these various domains and subdomains of wellbeing related to those. And just to kind of emphasise what that looks like, so we had one model looking at the predictors at age 6 to 7, and then those adolescent outcomes, and then separate models for each time point. A few things just worth highlighting in what we found. So when we looked at the broader domain level, the domain of feeling valued, loved and safe was protective across all age groups and across all of those 4 self-harm and suicide outcomes. Material basics, so things like having financial security, eating breakfast every day, that seemed to be more protective when those needs were met in younger children, and the opposite was true for the participating domain. When we look a little bit deeper at the subdomains, so we started to see a few more nuanced distinctions. I won't go through all of these, but I'll just put up a few kind of key findings here. A few implications that I just wanted to consider. So in our results, it became clear that multiple different domains of wellbeing were associated with self-harm and suicide as protective factors. Also, I think the relative importance of these factors changed across childhood, which I think has both research and policy implications. So on the research side, I think it's important that researchers don't overgeneralise across age groups. And on the policy side, I think the timing of interventions matters alongside the targets. So, for example, school-based interventions that target school safety might be more effective in those middle childhood years. And yeah, just I think for me, the novelty of what we were trying to do was to use a wellbeing framework to predict subsequent outcomes in adolescence. Wellbeing is obviously intrinsically valuable, but it does also shape outcomes across the life course. Just a few kind of caveats I feel I should mention. So for some subdomains in particular, and this is probably a good thing, almost all children had their need met in this data, which makes it a less useful or meaningful predictor, but it's nice to see as well. There's a standard correlation and causation, even though this is a longitudinal study. There are obviously other factors that might relate both to childhood wellbeing and to those adolescent self-harm and suicidality outcomes. And then the comparison across time, we do have to remember, as I said earlier, that the underlying measures of childhood wellbeing do change as children age. So, and that's because wellbeing does change definitionally, like by definition, but also, yeah, just the availability of variables on the LSAC. So there's our published study. I've put a link to Nest as well, and Kate and Ben's work, which you can actually also download their code and have a look at it yourself. And I'd also just like to acknowledge and thank my collaborators on this work. So thank you.